Access to Democracy is made possible by donations from the following organizations. Thomson Reuters, a global company with expertise and insight to unravel complex situations in the areas of law, tax, compliance, government, and media. Their worldwide network of journalists and editors keep customers up to speed on relevant global events. Thomson Reuters, The Answer Company. Crutchfield Dermatology, a full-service treatment center and Medi-Spa in Eagan. Their goal is to help you look good and feel great with beautiful skin. The Minnesota Twins are looking forward to another great season in 2023, led by the return of All-Stars Carlos Correa and Brian Buxton. With the return of numerous players who were injured in 2022 and some new acquisitions, another division crown and a return to the World Series are in their sights. Established in 2007, 45th Parallel Spirits was among the first 50 micro-distilleries in the United States. Based in New Richmond, Wisconsin, all aspects of production occur at our facility. If you're interested in visiting and learning more about the 45th Parallel Distillery, please check our website and plan a visit to tour our facility and taste our spirits. Truestone Financial, with locations in Minnesota and Wisconsin, has proudly served its members since 1939. Truestone engages, educates, and supports its members to ensure they have the tools to empower their financial well-being. Truestone Financial, your neighborhood credit union. Learn more at truestone.org.
Hello and welcome to another edition of Access to Democracy. Thank you for joining us. I'm Bill Raker, your host. Today we're going to be talking about the Minnesota Senior Linkage Line, and to talk with us about that is our guest, Amanda Bigus. Amanda, welcome to Access to Democracy.
Thank you. Thanks for having me here today.
It's our pleasure. We've got some very interesting things to talk with you about. Yes. Amanda is the Community Outreach Specialist with Trellis. And so, Amanda, let's start by maybe you sharing a little bit of something about yourself and your role with Trellis, and then we'll get into the more specifics of what that organization does.
Yeah, sounds great. So, as you said, I'm the Community Outreach Specialist for Trellis, which is the area agency on aging for the 7-county metro area. And in my role, I am out in the community working with organizations to bring education, resources, and really to spread the word of the Senior Linkage Line, which we'll talk about in a little bit. And I have spent over 10 years in aging services. I've had the opportunity to serve in a variety of roles that affect older adults. So I've worked at assisted living and retirement living, home care, adult day centers, and memory care as well. And in those collective experiences, it became very clear that aging is not a one-size-fits-all solution. Aging well looks different for everybody. And ultimately, that's what led me to Trellis and the Senior Linkage Line, because we are really able to work with people on their individual situation and help them find resources and services and give them support based on their situation. So that's what led me to where I am today.
Well, we're glad that you were led to where you are today. Yes. Because you're going to talk to our viewers about some really important information that will be beneficial to them and to their families. Yes. You mentioned the term Trellis and then the Senior Linkage Line.
Yeah.
Can you tell us a little bit, they may be new terms to many of our viewers, so what's the history of Trellis and what's its connection to the Minnesota Senior Linkage Line?
Yeah, so Trellis, formerly Metropolitan Area Agency on Aging. It was MAAA, so some folks might be familiar with that term. We changed our name to Trellis a couple years ago to kind of reflect the growth of ourselves as an organization. But Trellis was established in 1973, and it was a program of the Metropolitan Council. It was as a result of the Older Americans Act that was established in 1965, or passed in 1965. And Trellis, or Metropolitan Area Agency on Aging at the time, was tasked to provide services and support for older adults on things like nutrition and social services. Now in 1994, Trellis established itself as an independent nonprofit. Around that same time, the Minnesota Board on Aging established the Senior Linkage Line, and they created this service to provide more resources and support to older adults and caregivers. Now, Trellis is the area agency on aging for the 7-county metro area, as I mentioned, and we are designated as that by the Minnesota Board on Aging. So because of that, we are tasked with providing Senior Linkage Line services. So Senior Linkage Line is a program of Trellis. Now, Senior Linkage Line is a statewide service of the Minnesota Board on Aging, and we are a free information and assistance line. We help families, caregivers, older adults, anybody who calls. You don't have to be any age to call the Senior Linkage Line. And we can provide resources, answer questions, provide support on things like transportation. You know, if you are looking for transportation to a doctor's appointment, if you need a way to get out to the grocery store, we can help find those resources. We can also help with things like food support, you know, whether that might be meal delivery or congregate dining sites. You know, you need somewhere to go and enjoy a meal with other company. Senior Linkage Line also helps with Medicare. Medicare is a big one, especially right now during open enrollment, which I know we're going to talk about later. But we can answer questions, you know, whether you are first becoming eligible for Medicare or you've had Medicare for 10 years and still don't understand and don't know what the right plan is for you. We can provide a lot of support and help simplify things for people. Now, I think something that's important to know is that Senior Linkage Line is completely free, so it's funded through state and federal dollars, and we're completely unbiased. So we don't recommend or endorse one product over the other. You know, that's where I said we can really help people with their specific situation based on what's best for them. And I think that's also really important when it comes to Medicare. You know, we're not telling you to choose one plan over the other because we have no financial gain in any decision that anybody makes. So we're really just trying to find the best fit for people. And the last thing I want to say about Senior Linkage Line is, you know, we can also help with caregivers. And I think, you know, it'd be good to mention that November is Family Caregiver Month. And according to the Administration of Community Living, families are the primary caregivers for older adults and people with disabilities. And this can take an emotional, physical, mental toll on people. And they may be working, they may have other family that they're supporting, and so this can be a really big strain on them. So Senior Linkage Line can be there to help find caregiver support groups, respite care, you know, home care for somebody else to come in and help a little bit. So wide variety of services. You know, I often say we're the one-stop shop for all things aging.
Well, that's a wonderful phrase to share with our viewers. You know, Amanda, we have to repeat and to emphasize again that all of these services, everything that the Senior Linkage Line offers is free.
Yes.
To anyone who calls.
Absolutely. It's a free service for any Minnesotan, or even if you call outside of Minnesota and you're calling on behalf of somebody who does live in Minnesota. Mm-hmm. It is free. You know, we're kind of the middleman. So we have a database of over 40,000 different services called MinnesotaHelp.info, where we have all of these different resources. So it could be transportation companies, it could be housing, you know, assisted living facilities or 55 and over residential housing. And what we're going to do is we're going to connect people with those services. And sometimes people call, you know, and they just want a list of every single assisted living in their area, and they'll take it from there. Sometimes they want a little bit more than that. They might say, you know, what are the options and what do I do to help me decide which one is best for me. And Senior Linkage Line can say, okay, these might be some good questions to ask when you go tour these facilities. So, you know, there's kind of a wide range of help that we can provide as well. But I do like to mention, you know, if we do connect you with a resource or a service, you know, let's say it's some type of chore service, there might be a fee associated with that organization, but you're never going to have any charge from the Senior Linkage Line. There's no charge to call, there's no charge to meet with us. It is a free service funded through state and federal dollars.
And so just to clarify, is that there may be situations where the caller is looking for some kind of service that Senior Linkage would connect them with,
right.
But there might be a fee associated with whatever organization provides that service.
Correct. Yeah,
okay.
And you know, we can always work with financial situations too. You know, if somebody's looking for free or low-cost services, you know, that's good for the specialist to know so that they can help find those options.
So you talked about a specialist, which is someone that I would get on the phone if I called the Senior Linkage Line,
yes.
Right? So tell us a little bit about the staff. I mean, you have a paid staff, a certain number of people. Perhaps you have volunteers that work with the organization.
Yes.
Tell us how the Linkage Line is staffed.
Yeah. So under Trellis, we actually have over 100 different employees. We do have staff on the Senior Linkage Line, and then we have staff that are doing different programs underneath Trellis. So we do have a Juniper program, which is evidence-based health classes that are free or low cost to people that help with things like chronic pain management, diabetes prevention or education, Tai Chi classes, so things like that. We also have staff members who are working on Act on Alzheimer's initiatives and dementia friends, making sure that, you know, in Minnesota, we are dementia friendly. You know, we know that there is people walking around, going to the grocery store, going to the dentist that have dementia that may not have been diagnosed, and if we are able to recognize those signs and communicate in a way that will help them, you know, we're just going to be better as a community overall in supporting people with dementia. We have staff who do pensions and retirement rights. We have staff who, you know, we still administer Older American Acts funds, so we have staff who are working with community organizations to help fund these organizations that serve older adults. We have staff doing a wide variety of things. I'm part of the outreach team, and we also work with volunteers as well. We have 119 volunteers who help us do this work, and we could not do this work without them. We have almost as many volunteers as we have staff, sometimes more given the day. And you know, our volunteers help us in a wide variety of roles. And you know, this could be something like a Medicare counselor. You know, we have volunteers who are trained and experts in Medicare who they sit down one-on-one with somebody and they compare plans. We have volunteers who do presentations for us. They're excellent public speakers, so they're out in the community educating on healthcare fraud, Medicare, healthcare directives. We have volunteers who help with our pensions and retirement rights program. We have volunteers who are out in the community at events, doing exhibit events for us, talking about Senior Linkage Line. And we also have volunteers who just come to our office and do administrative tasks for us. You don't have to have Medicare experience because, you know, that's not everybody's cup of tea. But, you know, we have volunteers doing a lot of great things for us. So we really do count on them to make sure to get this work done.
That is so important, and it's essential that more people, more consumers know about the opportunities that they can get connected with through the linkage line.
Yeah.
And this may, you mentioned the Medicare and the Medicare Open Enrollment period earlier. This may be the time to talk about that.
Sure.
You know, right now people are seeing all these ads on TV about, you know, call this number and find out if you're going to get money added back to your Social Security and all of these other things. And the insurance companies are putting out all of this information about the different plans that they have. So the options and the complexity of understanding all of those options and which is the right match for my needs, my particular situation. How does the Senior Linkage Line play into that? How can they help people who are confused or needing unbiased information and discussion about making a decision?
Yeah, well, you nailed it right on the head there. I mean, it is a complex topic, and I mentioned that you can be on Medicare for 10 or more years and still not understand what you're looking at. So first I'll mention, Medicare Open Enrollment, October 15th through December 7th. During that time, if you're on Medicare, you can make changes to your plan. And anytime that you make changes, those changes will go into effect January 1st of 2024. Now, some people might say, I'm happy with my plan, I don't want to make any changes, and you don't have to. If you're happy with your plan, you're good to go. But I do still recommend, even if you're happy with your plan, make sure to review anything that comes in the mail from your plan, because they can make changes every year to premiums, deductibles, covered benefits, covered prescriptions, network of providers. So you want to make sure that everything is still working well for you and that nothing has changed that's going to affect your situation. Now, if you say, well, my premium went up, or my doctor's no longer in the network and I'd really like to find a different plan, or you're just not happy with your plan, you want to take a look and compare plans. Now, as you mentioned, that can be overwhelming for a lot of people. There are over 100 different Medicare Advantage plans in Minnesota. And so each of those have different premiums, different covered benefits, different network of providers. And so understandably, it's very overwhelming. And a lot of times people want to choose something and get it over with and not think about it, right? And in doing so, they might be paying more than they necessarily need to. Their benefits might not be covered that they need. So Senior Linkage Line, there's a couple different options how we can help. So you can call us on the phone. So the Senior Linkage Line number, 800-333-2433. I know we got that going on the screen.
Yeah.
But you can call us. Now, I do like to let people know, lots of people call Senior Linkage Line during open enrollment. There's lots of questions. If changes happen in plans or plans leave the market or new plans come on the market, there are questions. And so we get a high volume of calls during Medicare Open Enrollment. So I say that just to warn people, if you're calling Senior Linkage Line, you might be on hold a little bit. But if you are, hang in there. We will get to you and we will...
Be patient.
Yes, be patient, please. We will get to you. But the other option is to make a Medicare counseling appointment. Now, these are one-on-one Medicare counseling appointments with an unbiased Medicare counselor. These are trained volunteers who can sit down with you and look at the plan that you currently have and help you compare plans to find out what might be best for you. We have a Medicare counselor who she sat down with a couple and they weren't happy with their plans. They had two completely different plans. Now with Medicare, one spouse might have a different plan than the other spouse. They're not joined. But they said, well, we want a similar plan. And so she sat down with them and she helped them find, got them on the same type of a plan and saved them $1,400 a year. So, it doesn't hurt at all, even if you're happy with your plan, to take a look at what else might be out there, because our Medicare counselors have an idea of what's included in these plans and can take what you need covered, whether that's certain benefits or prescription drugs, and they can help you compare plans and find what might be best for you. Now, we don't tell you what plan to choose. We don't say, oh, this is the best option for you, enroll, right? We say, okay, here are 3 to 5 options that would work for you, and then we help people make an informed choice. So ultimately, the decision is up to the Medicare consumer, and we always want to empower people to take their health insurance into their own hands. It's not always easy. It's, like I said, very overwhelming, very complex. So that's why Senior Linkage Line is there to kind of help simplify the process.
So let's put emphasis on this again. If a person who needs help or has questions about a Medicare plan or their Medicare coverage, and they call the Senior Linkage Line, they're going to be connected with an unbiased counselor who is not a paid insurance broker.
Correct.
Okay, because most of the, if you call an insurance company or you call one of those 800 numbers on the TV screen, you're going to be connected with a licensed, hopefully a licensed insurance broker.
Correct.
Who's going to be paid if they convince you to sign on with some particular Medicare plan.
Yes.
Okay? So that's an important distinction to make sure that people understand.
Yeah, it is. And, you know, I get that question a lot because we're seeing that advertisement over and over, like you mentioned. People get postcards in the mail. They see advertisements on TV. You know, sometimes there's even a table set up at the grocery store advertising Medicare Advantage plans. And people always ask, you know, how do I know if that's a good plan or not? Is this legitimate? Mm-hmm. And what I will say to that is that, you know, it doesn't necessarily mean they're bad plans, but if an insurance broker is giving you 5 plans to choose from, it means they have financial gain from those 5 plans. It doesn't necessarily mean that it's the right plan for you. So if you're going to go with, you know, somebody who is paid to give these plans, you just want to make sure it's a good plan for you. You know, still do your research. You can always go on Medicare.gov to look at plans. You can also, there's a publication called Healthcare Choices for Minnesotans on Medicare, which lists a comprehensive overview of every single Medicare Advantage plan. So if you see a plan being advertised and you're wondering if it's a good plan for you, you can always check it out or call Senior Linkage Line if you're not sure.
And again, get some unbiased
Yes.
information on helping make that decision.
Yes,
Good.
yes. And I should mention too, there are over 30 different locations in the Twin Cities metro area where you can go for an in-person Medicare counseling appointment.
Okay.
You know, people like that face-to-face, you know, it feels a little bit better, a little bit more comfortable to have that face-to-face interaction to help you go through all of this and have that information right in front of you. But if you don't want to go in person, we can also do phone appointments.
So listening to all of this, Amanda, I'm just really impressed with what kind of an organization or what kind of a service the Minnesota Senior Linkage Line is. What sets the Minnesota Senior Linkage Line apart from some other organizations out there that may be offering similar kinds of services?
Sure. You know, I would say, first of all, that we're completely unbiased. You know, that's huge when it comes to helping people where they really need help, to help people age well. And I would also say, you know, our database of over 40,000 services, you know, we have a data management program that really looks for the services and tries to have at least 3 options in each category for each zip code. So we really try to have a wide variety of services available for people to help them. And you know, I think it's also important to talk about, you know, Trellis as this really important organization doing work for older adults too. You know, because Senior Linkage Line is one program under Trellis, but you know, there are a wide variety of other things that Trellis is doing to help older adults and, you know, really being a thought leader and innovator in the field of aging.
I think the demographic statistics say that since 2020, the number of people in Minnesota 65 years of age and older outnumber the number of students who are school age.
Yes, that is true.
What are the implications of that for the projected needs of an organization like Senior Linkage Line?
Yes. There are over 950,000 people in Minnesota who are age 65 and older. So it is we are an aging population, and I think, you know, Senior Linkage Line and Trellis, you know, as people live longer and there's more people who need housing, who need health care, you know, it's going to put a strain on resources. And so, you know, we need people who are working in the aging field. You know, we need caregivers. We need people who are, you know, helping with funding for programs in the field of aging. And I think something that's also really neat that Trellis is really working on is bridging that gap between healthcare and social care. You know, it's really important to have things like, you know, access to good doctors and being able to pay rent and being able to afford groceries. You know, those are all really important things that we need as we age. But in order to really have fullness of life, we need things like social classes or exercise classes. We need opportunities to explore passions, to really create this fullness of life. And I think Trellis is doing what it can to really try to bridge that gap. And I think Juniper, the program that I mentioned earlier, is a really great example of that, providing those evidence-based health classes that people can attend.
So as we wrap up the program today, Amanda, are there other organizations that Trellis or the Senior Linkage Line kind of partner with or work closely together to make sure that people are aware of these services?
Yeah. My job being in outreach, we work very closely with community organizations. We work with as many community organizations as we possibly can because we know that we all have the same goal of helping people age well. The mission at Trellis is to optimize well-being as we age. And so we know that the only way that we can do that is work together with organizations in the community. So we form strong partnerships with other organizations that serve older adults. And specifically our outreach team, we have been focused on doing 70% of our outreach in communities of color, communities that are struggling with poverty, rural areas of the Twin Cities, because we know that those are the people who may not have access to resources like the Senior Linkage Line. So we are in those communities working with organizations that serve those older adults to be able to give them access to this important resource.
Well, Amanda, thank you for being our guest on Access to Democracy today and for telling us about Trellis and the Minnesota Senior Linkage Line, which we want our viewers to know is free and it's there for them, and we encourage them to use it. And if they have a particular question or need during this open enrollment for Medicare, go to Senior Linkage Line, get some unbiased opinions, some unbiased information, and make a good decision for your health. Amanda, thanks for being a guest on Access to Democracy.
Yes, thank you so much for having me.